Good afternoon. Welcome to the EMA office here in St. Clair County for day 436. Joined here with Chairman Mark Kern and Mila Blanford, Director of the Health Department. Thanks for coming in on Sunday and giving us the numbers.
Thank you. Good afternoon, everyone. For Sunday, May the 23rd, we have 12 new positive tests out of a total of 657 for the day. The age range of those individuals is under 10 to in their 70s. The county positivity rate is at 1.8%, with the 7-day rolling average at 2.5%. The regional positivity rate as of May the 20th was at 2.5%. Gratefully, there are 0 new deaths today. Countywide, we've conducted a total of 359,184 tests, consisting of 30,995 positives and 328,189 negatives. Total deaths to date is 479, and our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 30,333. Statewide, we've conducted a total of 24,233,267 tests, with a total positive number at 1,375,508, and that's an increase of 943 since yesterday. Total deaths to date is at 22,623, and that's an increase of 24. Hospitalization numbers, we have 14 COVID-related hospitalized patients in St. Clair County, and regionally we're at 31. Number of patients on ventilators in St. Clair County is at 0, and regionally we're at 2. For congregate care, we have no new cases to report for today. Again, with testing at St. Clair Square, they have availability on Monday, Wednesday, Friday, and Saturday, as well as CVS, Walgreens, and Med Express. We continue to offer vaccine at the fairgrounds until May 30th. We're there from 8 to 6:30, and you can drive up without an appointment from 9 to 5. The only day that we are closed is on Wednesday.
And then after May 30th, we'll be at 330 West Main.
That's correct, and you can go to our website and register online for your second dose vaccine or first doses there. We'll have Pfizer, Moderna, and J&J at that location.
So we're going to continue to vaccinate and
We sure are.
see if we can get the highest percentage possible.
Right, and we will also have mobile clinics that go out to the different municipalities or schools so that we can, offer that opportunity to anybody who is interested.
Great. Thank you, Mila. All right, let's take a look at the zip codes. 62206, we're up 1 to 1,429. 62207 is up 1 to 646. 62208, up 4 to 1,755. 62220, up 1 to 2,208. 62221, up 1 to 2,961. 62223, up 2 to 1,882. 62225, up 1 to 158. 62226 actually goes down 2 today to 3,399. And remember, we subtract positives from areas if upon tracing we find out that perhaps a wrong address or zip code was reported. So then we take time to correct those in our numbers so you have the most accurate numbers possible. Sometimes if a person is in short-term in a nursing home or rehab and they report the nursing home address rather than the home address, then we make those corrections. So that's why sometimes you see a negative number on the COVID positives. 62239 goes up 1 to 504. 62260 down 1 to 838. And 62264 also goes down 1 to 376. 12 new positives, 657 people tested, brings our county positivity way down today to 1.8%, which then brings our rolling average down to 2.5%. Regional positivity, though, ticks up a little bit to 2.5%. Bond County called in today at 3.4%. Clinton, 2.2%. Madison is 3.1%. Monroe, 4.1%. Randolph is at 0% today. St. Clair, 1.2%. And Washington County is at 0%. But those regions really, although we're still tracking it, the state is looking at everything now statewide. So the regional numbers don't have as much import to the state, but they do give us a sense as to where we are. And a regional positivity at 2.5% is a fairly decent number compared to where we've been.
Oh, yeah, we'll take these numbers to where we were, a couple hundred days ago.
Right.
Remember those?
I remember
Yeah,
those.
We've come a long, long way. Today is question and answer day, and we've only got a few. So Brian, if you want to get, before Mila gets the bulk of them today.
Yes, sir. Milo, the first question says, are you able to give any specifics on the patients who tested positive for COVID variants, such as male or female, age, hospitalized events, home recovering, or maybe how they came in contact with it? Thank you.
So not at this time, we're not providing the demographic information, but the way the process works is that each of the local labs takes a subset of their COVID positive samples and then submits those to IDPH for further sequencing. In addition, if a physician wanted to submit a sample for atypical presentation or some other reasons, they could go ahead and do that as well. And then once the state lab sequence those, if they're positive for then do notify the local health department. Usually there's been several to maybe 2-3 weeks lag by the time a person would initially test positive, and then they're sequenced for a variant, and then it's reported to us.
Okay, thank you. The next one, very similar, says, how does medical staff tell that a variance of a COVID person has? So that comes from that lab.
Correct.
Okay, and then one last question says, has there been any known infections after a person has been vaccinated?
Yes, we call those breakthrough cases, and if they result in either a death or hospitalization, we then report that information to Illinois Department of Public Health.
But really, it's rare, and all
Very small
along,
percentage.
they've said that these vaccines are 95% effective, supposed to be close to 100% effective,
That's
keeping
right.
you out of the hospital and getting tremendously sick. But there's always that breakthrough case.
Right, and it could, have something to do with somebody's pre-existing health conditions and that sort of thing as well.
But they are specially tracked so that the science is figuring out why.
Yes.
All right.
Thank you. Chairman, one question for you, and you kind of discussed it already here, but the person asked, how do we get negative statistics? Sometimes I hear a county had a negative test percentage or a zip code had a negative count for that day. How does that occur?
So we did talk about that. You know what I can say? We try to have, and I think we have succeeded in having the most accurate numbers possible. We could just take that number off because we find out that perhaps someone wasn't in that zip code because it was a misreported number, and through tracing, through other methods, we find out that was inaccurate. So we add that in the zip code where it's supposed to be, subtract it from the one where it isn't. But what we're finding is having these accurate numbers has been very effective for us. It's been important. I know a lot of people are interested in watching the zip codes every day, so that's why we continue to do this. But we do find somebody reports, they don't do it on purpose, it just happens, and then they get transferred elsewhere, so the zip codes do change.
Well,
Herb?
and that's been that way for 436 days now. Anytime that there's been any mistakes or that we have found out, we have immediately come back and let Team St. Clair know because of transparency. We wanted everybody to rely on this information, and I think that overall everything has been working like a well-oiled machine. The health departments, everything that we've been reporting. And that's why those numbers come up negative. As you said, we wouldn't have to do that, and probably none of Team St. Clair members would ever know the difference because we're reporting every day. But in the spirit of keeping everybody informed, like that's what we've been committed to do, and we will continue to do that. As Milo said, the Mass site is going to shut down on May 30th, but doesn't mean it's over with. 330 West Main Street will be up and running. We still want you to call, make your appointments for that. The National Guard's still going to be somewhat involved.
We will still have a guard team here, as well as 2 nursing teams in St. Clair.
Good. So as
And there's 2 good examples going on today of why being vaccinated is so important. The Blues are in a must-win situation, and we're able to go to those games. People are able to go to those games because they're vaccinated. They're increasing the number of people in the audience because of vaccination rates. So we're able to get things back to normal. Hopefully the Blues will get back to normal and win this game today. Cardinals, same thing. They're now increasing the numbers, and the people who are vaccinated are the ones who are eligible to go. They don't have to wear a mask. You can do all the things that you used to do, but you've got to get vaccinated. And that's why having these accurate numbers, having the best information available to you on a daily basis has been the way to try to get our lives back to normal. That's been the whole purpose 436 days ago. All we've been talking about is getting back to a situation like we are today, where we got a couple games that we can go to if we could get tickets. And
The light at the end of the tunnel
It
is
is.
brighter now than it's been for 436 days. But you know what I find interesting, as we talked about before we went on the air today, is that the amount of people that when we're out that we're seeing that's still wearing the mask, which I think is very encouraging, because I think that has set the mindset of people are saying, hey, I want to make sure, I want to be safe, because we had a period of time where we let our guard down a little bit and it went back up. But right now I think we're in good shape. The numbers are looking good, and we're going to continue to move forward and keep you informed. Cindy is with us today, so we'll be back in a few moments with her to translate this into our Spanish communities, and then we'll be back tomorrow for day 437. Everybody have a good evening.